Good afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. For a moment of gratitude today, we'd like to thank those who came out for testing last week, whether that was at the drive-through model in Lonsdale or one of the events on KCDC properties this weekend. We'd also like to thank our partners who helped us hold these events, the National Guard and PASS Group for their support, and KCDC also for their support in allowing us to access to their, those they serve and their properties. We continue our drive-through testing this week, today, Tuesday, Wednesday, and Friday. We normally reserve Tuesdays and Thursdays for targeted testing, but today we didn't have any scheduled, so we've opened up the schedule. So anybody who wants to get tested can call 215-5555, and they'll be given a time slot in which to arrive to be tested. The public can also get information about our testing options at walk-in and about other testing options at walk-in and urgent care clinics and some other private providers by calling the same information line. So another reminder that we're not the only testing opportunity people have in town. Moving on to our local situation. We have 311 confirmed cases of COVID-19 in Knox County. Additionally, we have 4 probable cases. 261 of our cases have recovered. 37 individuals have been hospitalized at some point in their illness. We are pleased to report that no individuals are currently hospitalized. And we are also grateful to report that there have been no additional deaths due to COVID-19 complications in Knox County. And now I'll open it up for questions.
All right, the members of the media will please go ahead and type your questions into the chat box. Okay, here we go from WVLT. How will businesses and other public spaces be affected once phase 2 is implemented?
Well, the details of phase 2 are in the process of being created. We're looking at the data to inform the decisions that are made about whether we enter phase 2 or whether we don't. As you know, the data looks really good right now, so we're encouraged by that. So we'll be putting that information out, some information this week, more information next week about that. So the listserv is one way people can find out. So sign up for that listserv. You'll get that information pushed out to you. And obviously we'll be releasing it publicly as well in other ways.
All right, from WBIR, does the health department plan to give recommendations to the school system in regards to opening in the fall? If so, have those conversations started?
We certainly are happy to provide consultation and advice to the school system on reopening. Some of their guidance does come from the state. It's not like some of the guidance we get comes from the state. So some of the guidance will come from the state Department of Education to the schools. And so I'm sure they'll follow that guidance as well.
And then the second part was, if so, have those conversations started?
Oh, sorry. So we have not officially started any conversations. We are in conversation with the schools on a regular basis and have a relationship with them, but those have not officially started at this time.
Okay, from the News Sentinel, the mayor released a statement Friday saying he thinks the county could open before 5/28. He said, quote, "If Governor Lee and State Health Department believe it is safe to further loosen restrictions on certain businesses in 89 counties, I see no reason why Knox County can't follow suit," end quote. Do you think Knox County is ready to, quote, follow suit?
We're looking at that data and we'll be using our benchmarks to help guide our decision as to what we do regarding phase 2.
From WVLT, have active cases been decreasing long enough to determine whether Knox County is trending downward?
So we are trending downward. I am actually going to take a deeper dive into the data with my staff today because we're really at that point where we need to make a recommendation to the committee and the community about what happens regarding phase 2. So I'll be taking a deeper dive into that data today.
Okay, from WBIR, the Loudoun County mayor mentioned many of the mushroom factory workers who tested positive for COVID-19 lived in counties surrounding Loudoun County. Do some of these workers live in Knoxville, and is KCHD getting involved with a plant outbreak?
As you,
a couple others too.
As you know, we don't discuss case specifics. But we do work with the region that are the 15 counties that surround Knox County in doing case investigations. If any of those folks live in Knox County, we'll be involved in helping them and supporting them in their response.
Okay, I think this kind of answered it, but I'll read it anyway. Is
Sure.
there communication between the health department, either Loudon or regional departments, when there are clusters identified and the individuals may live in Knox County?
Yeah, there's almost daily communication between us and the East region, since, you know, people travel back and forth, live here, work here, play here, and maybe live in one of their counties also. So,
Okay, from WUOT, following up on Tyler's question, could you characterize your communications recently with Mayor Jacobs?
I talk with the mayor regularly and talk with Brian Hare, our chief of staff, more regularly than that, keeping up to date on what's going on in the situation that we have. So we talk regularly.
From WBIR, is there more research on heat and the virus? Does the 85-degree temps kill the virus? And finally, are we safer outside than inside?
So I'm not aware of any study or anything that's looked at temperature and as it relates to COVID-19. We do know sometimes temperature does impact how we spread some germs, but I haven't seen anything definitive about COVID-19 regarding that. And honestly, yes, you are a little safer outside. You're not totally safe. We still cough, sneeze, and droplets come out of our mouth when we talk and stuff. And you know, if you're running, you're going to have a lot more droplets coming out of your mouth. So you need to still maintain 6 feet of distance, but because the air moves more quickly and changes, it's not as static as it is inside. We tend not to pass things to each other outside as readily as we do inside.
And then the final question from that series from WBIR was, do we need to wear a mask outside?
If you can't maintain 6 feet of social distancing, we still recommend that you wear a mask outside.
Okay, from WATE, we had a substantial drop in active cases over the past few days, from 67 to 45. Had there been a large group or cluster of recoveries?
So it's just the natural, not the trend, that's not the word I want to say, progression. People roll out of isolation, roll out of being in isolation based on when they became ill. And so if you look back at our epidemiology curve on our website, you'll see that we had more cases previously. And so the people are just rolling off being in isolation and going to recovery.
Okay, from WBIR, as more places open, is KCHD worried about the difficulty of contact tracing?
It does present a bigger challenge for us when we have more potential contacts to a case. But it's something that we're prepared to do and something that we do on a regular basis. When we have someone who's ill with a contagious disease, or we have an outbreak related to, say, to a restaurant, we have ways to get that information. We work with those restaurants or stores to gather information and contact those who are at risk.
Okay, from a WVLT viewer, they submitted this to the station, and the station's question reads, when will it be safe to visit our families?
Well, you can visit your families now as long as you can maintain social distancing and you keep the number small, 10 or under. And you know, you might even want to wear a mask if you're talking about your family that's maybe not in a long-term care facility. If you have somebody who's in a long-term care facility, those facilities will stay restricted to visitors for quite some time to protect those very vulnerable folks that live there. But with some precautions, you can still visit with your family and just follow the guidelines.
Okay, from WBIR, if this is a marathon, what mile are we on? Have we won the half marathon medal yet?
I'm not ready to say we've hit the half marathon yet based on what we're seeing with cases. I think we're getting close though. I hope we're getting close, but time will tell.
Okay, and from WUOT, how are you navigating the task of reminding people about the risks of COVID-19 in the face of public fatigue with the news cycle? And there's several others, but I'll start with that one.
Okay, that's a great question. And if anybody has any good ideas on how to do that, we welcome them, because this is one of the ways we're trying to get information out there for people, to remind them to keep doing these things. We need other people to carry our message. Folks who put things out on social media, putting that reliable message out on social media about wearing face masks, social distancing, washing your hands, staying home if you're sick. So we need help from the public to support that and to get that out to share it with their friends and family is another way that helps us get the message out.
Okay, how concerned are you that wishful thinking will overpower caution?
I think I trust people to use common sense and don't get too excited about the numbers. The numbers tell a story of where we are. They're very important, but they can change at any time. I think if we take the case of Nashville, I believe when their outbreak really got up and running, they had 600 cases in 1 week. We haven't had that, thank goodness, here in Knox County. So we want everybody to continue doing the things you're doing to reduce risk for yourselves and your families.
Okay, and this one more from WATE. The City of Knoxville and Chamber of Commerce have been sharing a survey seeking public input about reopening. Does the health department plan to use the results of this survey in any way?
So that was something the task force took on. We're thankful that they did that. So getting community input is very important as we create phase 2 and 3 of our reopening plan. So the task force will take that input and use it to inform decisions that we make regarding phase 2 and 3.
Okay, if there are any other questions from the media, please go ahead and put those into the chat box. One more time, if there are any more questions, we'll give you 1 more minute to type those into the chat box if you have them. Okay, well, thank you all very much for joining us, and we'll see you tomorrow at 12:30.